Welcome to OET Answers. In this segment, we are going to say about how to utilize 90 seconds in OET listening, especially in the Part C. So I know very well, I have a lot of students. So there, the major problem is they don't know how to utilize the 90 seconds. Okay, if they did not utilize the 90 seconds, definitely when they are moving to the question part, that will be really difficult for them to follow the questions, follow the audio, and taking the right answers. Got it? So we can see in this video, and I'm going to teach you how we can utilize the 90 seconds effectively. Shall we move on the page? So first, the 90 seconds. The time is really crucial to understand the topic and get ready to answer the questions effectively. So first to see this, why 90 seconds before Part C audio? Okay, why the 90 seconds are important? Which allows you to read the question and answer options in advance. Okay, so if you are reading your question and answer options in advance, that will help you to go through the audio and follow the audio, what type of information you need from the audio, everything you can select perfectly. Got it? Okay. Before seeing about the preparation time, we can see a goal of the 90 seconds. Okay, so the 90 seconds, which helps to preview the questions and options. So you can listen more actively and identify the answers faster during the audio. Clear? Okay, now we can see the preparation time. Why the preparation time is crucial? So I have given 4 reasons here. Let's see one by one. So first one, familiarity with the content. So by the word itself, we can understand clearly familiarity with the content. So what do you have to do here? Before listening to the audio, by reading the question. So before the question, you can see a scenario, right? So like a physiotherapist talking about athletics food, right? So this is an example, same like a, so in your question part, you can see the scenario, right? So by seeing the scenario, you should make that very familiar with your content, right? So you get an idea of what the speaker will be talking about. Okay, by reading the question and the scenario, you can get the idea what the speaker is going to talk about in this paragraph, like whether any medical innovation in the sense smartphones with a pacemaker, right? Then any clinical experience. Okay, so the doctor who has crossed over some experiences in their field, right? So they will share about that, and some other discussion about the health conditions like chagas or any other tuberculosis, and medication compliance, or the patient is not compliant with the vaccination, so everything. Okay, so lots of or varieties of discussion will be there, so that you should make a familiar with that. Got it? This is the first step. And second one is focus listening. Focus listening means you need to know the questions in advance. Okay, so in the 90 seconds, what is our duty? So we have to read the question and getting the keywords as well, right? So you can actively listen to the key details or the opinions rather than passively trying understand everything. What does it mean? Which means don't try to read everything at the time of audio playing. Okay, you have to give separate time for read the question, read the answer options, predicting the answers, and followed by that, listen to the audio. And finally, you will mark the answers, right? So you have to provide individual time for each activity. Don't do everything at the time of playing audio or listening to the audio. I hope that is clear to you. Clear? Right. Then third one is understanding question type. So by reading itself, you know very well. If you are following our channel, you know very well. Already, I posted lots of strategy videos like types of questions in the reading and listening. So same thing will be reflected. which means you need to identify what type of question here being described, like a writer's opinion, speaker's main idea, or speaker's specific detail about particular thing, or any other effects or implications, finally reservation. So based on the question you have to approach, you know very well, right, how to approach the types of questions. So according to that you need to approach. Got it? And finally, time management. So in this preparation time, the time management is really crucial. You know very well the listening audio, how it will be. Is there any specific time for any other stopping or starting there? Nothing. So you have to start a particular point, and where the audio stopped, there you have to stop. Got it? Time management. So the time management helps you to decide how to divide the attention between listening and marking answers. Got it? So no need to read the answer options and marking the answers when the speaker is talking. Okay, you have to listen clearly, and you should prepare the answer options and marking the question keywords in advance. Okay, so which reduces your attention or cognitive overload. I hope you clear in this page. So now you may have the query how to approach the 90 seconds, how to approach exactly on the particular question or examples, right? Okay, we can see everything detail in this video only. Okay, so first I'm going to teach you how to approach this. I have made some steps here, step by step, which this is the guide that will help you in 90 seconds preparation time. Got it? So first, look the step 1. Quickly read through questions. Okay, so quickly skimming the questions very quickly. So first 30 seconds will be provided for that. Okay, here what is your role? You have to focus on the question. Question stems means what the question actually asking you to find out, whether speaker's concern, speaker's opinion, speaker what the speaker giving reasons or any other explanation, reason, reservation, advice, what type of the question stem asking you. So these are the examples I made here. Okay, for example, I can tell you what kind of information that you're listening for. For example, opinion, reasons, advice, as I reflected there, right? So we can see the exact example. What is Dr. Patel's main concern about the treatment? Okay, think that this is your question. What is Dr. Patel's main concern about the treatment? So here, what is the question stem? Patel's main concern. Okay, main concern is a question stem. Regarding what? Regarding the treatment. So you now know you should listen for Dr. Patel's opinion or the concern. Are you clear with this page? Okay. Now we can move on to the second step. Scan the answer options. Scan the answer options. How long you can take for this? Next 45 seconds you can utilize for scanning the answer options. Okay, so you need to read all the 3 choices A, B, C for each question. Okay, not only I'm telling about the single question. In the first extract, 6 questions will be there. The 6 questions you have to follow the methods. Okay, then the second step is underline or mentally note key differences or keywords in each choice. So how can you do that? You have to underline a specific word from each option. Option A, B, C. In the 3 options, sometimes you can see 2 options will be similar, look alike or meaning wise. Right. Another one will be completely contrast. Okay, so how can you tackle the similar options? By underlining, by differentiating the meaning or differentiating the words. Okay, so you have to make some key differences what they have given in the answer options. Clear about the second step? Finally, look at the third step. So third step is about predict the topic and the tone. So finally, 15 seconds will be provided for predicting the topic and the tone. Use some question content to guess the prediction and the topic. Okay, so first, who is speaking? Okay, when you're trying to predict the topic and tone, what you have to do? You have to determine who is speaking, whether doctor, nurse, pharmacist or physiotherapist or any other specialist. Okay, then second thing is what is the topic regarding what they are discussing, whether training program, about the medications, about the diagnosis, or about the equipment. Okay, what type of conversation is going there. Then what kind of language to expect? Okay, note the point. What kind of language to expect means you have to understand. I have to find this information from the audio. Okay, what type of information? Author's opinion, author's reservation, or main reservation, or the any other concerns or recommendations about the question or the audio. Okay, so you need to find out from the paragraph. So these are the really important steps to tackle the 90 seconds very effectively. If you really follow these are the steps effectively, you can get the right answers. Am I clear to you? Okay, now I will give you one more example here. What does the speaker, note this, what does the speaker suggest about training programs? Okay, so what does the speaker suggest about training programs? Here, what you have to note? You have to note speaker suggestion. Okay, who is speaking? So first step is who is speaking and what type of topic that you have to understand when your audio playing, that you can understand, and what kind of language to expect, that is suggestion. Okay, here the suggestion. So training program is a topic. Got it? So everything you can describe here, everything you can understand very well before hearing the audio. Clear? Okay. So finally, you need to know some pro tips. So common issues, what are happening and how to fix this. Everything I have described here. First thing is don't try to memorize the options, just understand what to listen, which means I pleased you to follow. Don't try to memorize. Okay, don't bygo the answer options or question keywords. Okay, just understand. Understanding is really very easy than the memorizing. Okay, so just understand what you have to listen from the audio. What is your need from the audio? Don't read everything, don't listen everything. Okay, what is your need? Your question only will guide you. Okay, what is your need? What you have to actually understand from the paragraph, means like audio. Okay, then second thing is pay attention on question order. They follow the sequence of the audio. Okay, just to focus on the question order. Okay, in which question they are discussing and which question they are coming now, what question they are going to discuss, everything you should understand. So the question order only will follow the sequence of the audio. Okay, they never mix with the audios or the questions. Then third one is look out for distractions. You know very well what are the distractions will be there. So usually we have some distractions. Rather than that, in the audio and when you are preparing, what are the distractions will be there, like choices that seem correct but are not fully supported by the audio, means it seems look alike, it is correct by your understanding, that is correct, but the audio will not be supported. You need to determine where audio is a proof, question is a guide. Okay, so both you have to use both guide to get the right answer. So maximum you need to take the correct answer. If you want to take that right path, you have to follow these are the steps. Clear? Okay, here we can see some examples for your better understanding. I'm going to show you how to apply 90-second strategy on this extract. This is part C, extract 1. So as usual, notification questions 31 to 36, you hear a discussion between Emily, Hughes, and Joshi. So this is about what? Discussion. So how many of them involved? Two persons, Dr. Hughes and Joshi, regarding diabetes management. From this scenario, you can clearly understand what is going to happen in the whole audio. Am I right? So now we are coming to the right path. You now have 90 seconds to read the questions. Look at the question number 31. Dr. Hughes mentions that one of the primary objectives. Okay, so first underline Dr. Hughes mentions. So your first task on the 90-second strategy is quickly read through the questions. Okay, quickly read through the questions. You have to read the 31 to 36 questions within 30 seconds. Okay, You have to read all the questions. Meanwhile, you need to understand the question meaning. Okay, first, Dr. Hughes mentions. So I underline Dr. Hughes mentions. Okay, here mentions very important. I already told you. So what kind of information that you have to look on the audio? That statement will be provided here, like a Hughes mention. So mentions, like it indicates opinion, suggestion, advice, any of them. So you have to take this in your memory and look for the answers on the audio. So what Dr. Hughes mentions, okay, what is his suggestion or opinion, that you have to find it on the audio. Then one of the primary objectives, so there he may explain multiple objectives. So one of the primary objective only he is explaining here regarding new diabetes report is. Okay, new diabetic report is. So report is and colon used. What is that meaning? Because when you are applying answer, it should be like a continued one. Clear? Okay. So first task completed successfully. So what kind of information you are listening for, that you underline that Hughes mentions. Then second task is to motivate younger individuals to adopt healthier eating patterns. Why I'm reading this? Because your second task is about to scan the answer options. So next 45 seconds will be provided for you to read all the options. Got it? So in the second task, what do you have to do? You have to read all the three choices and you need to underline, or you have to mentally note the key differences or the keywords in each choice. Okay, so what you have to do is A, B, C, three options will be provided. Sometimes two options will be like similar. In order to prevent confusions, you have to make underlining process. Like you need to differentiate the meaning or differentiate the words. Exactly, you have to focus on the meaning. Whenever you are reading each options, the meaning should be like differ. It should not be a same thing. Okay, so accuracy you know very well, right? If a word has similar changes or little bit slight changes will be there, means you can differentiate that. You cannot consider that everything is same, around same, probably same. You cannot say anything. Okay, so you have to differentiate everything. So to motivate younger individuals to adopt a healthier eating pattern, so here first keyword is motivate, like encourage younger individuals. So exactly, younger adults adopt a healthier eating pattern. So adopt means compliance eating pattern. Okay, then second, you have to differentiate A from the B, B from the C, A from the C, and A, B from the C. Like you have to differentiate. Now B option, to offer. Can you say motivate and offer are same? No, it is completely different. Understandable guidance for managing the disease. This is about managing diabetes and guidance. Underline these three. Then third option, to ensure faster referral to specialist. This is about not diet or guidance. This is about only referral with a specialist for patients with diabetes. Got it? So you are differentiating the three of them. Now when audio is playing, you can remember everything. I'm not asking you to memorize everything, but you have to say that I can remember these are the difference between A, B, C, and these are the statements they have provided when you have give a single look. Clear? Right. Now third task, that is predict the topic and tone. So here 15 seconds will be provided. So you need to predict the topic and tone. How? What we can understand from that? So like who is speaking, what is the topic of the paragraph, or what kind of language we can expect. So whether our answer would be a opinion or recommendation or any other thing. Okay, you have to predict what might be my answer. Like to motivate younger individual. So already we read the question, right? Dr. Hughes mentions that one of the primary objectives of new diabetes report. So his statement or his opinion, we have to focus on the audio. Think that these three options are comes under his focus. So one of the primary objective and his suggestion we are going to take there. Whether his suggestion like to motivate younger individual to adopt a healthier eating pattern or to offer understandable guidance for those manage the disease or to ensure faster referral to specialist for patient with diabetes. So any of the one would be the right one. So that you have to predict. Okay, probably 80% prediction will be there, and it should be suitable with your exact imagining and the audio, right? So to offer understandable guidance for those manage, one of the his suggestion is about A, B, or C. Okay, that you have to predict. How can you predict who is speaking, what type of conversation is, whether the one of the objectives which matches with the answer option or not. So when audio is playing, that you can confirm clearly. Got it? Then the same thing we can apply on the question number 32. According to Dr. Hughes. According to Dr. Hughes, what does that mean? Which means based on his perspective or according to or else his viewpoint or his suggestion, like previous one, a significant challenge, underline this, like a complication they have talked, a significant challenge in managing diabetes on younger individual. This is already continued with the first question. So here, according to his Hughes statement, a significant challenge among these people that you need to identify. Go to the second step, scan the answer options. So they may not recognize seriousness of the condition. They are more likely to experience complication from type 2 diabetes. They may not adequately. So two negative statement, A and C are most similar. They may not recognize and they may not adequately express the symptoms of low blood sugar, may not recognize the seriousness of the condition. So probably both are same. When audio is playing, that thing we can confirm whether about the symptoms of low blood sugar they have spoken or option A, seriousness of the condition. If they multiple information they have provided means which comes under seriousness of the condition, means all statement will comes under here. But option C is only about the express low blood sugar. So only they are talking about symptoms of low blood sugar, means we can confirm with the option C. Okay, so you have to differentiate these two. And option B, they are more likely, means possible to experience complication from type 2 diabetes. This is contrasted from other A and B. Clear? Now, final is prediction. What might be my answer? Okay, what who is talking or his statement we have to take, right? So his opinion would come as my answer. When audio is playing, that time we can confirm that. Look at the question number 33. Dr. Hughes states, again states means opinion or suggestion. Resuming physical activity. So returning to physical activity soon after a hypoglycemic episode is risky because. So because the word or phrase because have given. Why? What is the meaning of because here? Whenever you see because in the question means you need to find out the reason, because it could result in life-threatening complication, or because blood sugar levels may drop, because it could cause reversible damage, like you need to identify. So two things you need to consider. One is his statement, opinion, and these returning to the physical activity as much as possible after a hypoglycemic episode is risky, because so you have to identify the reason why it is risky. So first look at the three options. You can differentiate, okay, by scanning the answer options. So you can take 45 seconds for reading all the options. Okay, I'm repeatedly saying this to remember everything. It could result in a life-threatening decline in blood glucose. Life-threatening decline means very low, like 0 stages. Then it could result means it cause. Then blood glucose level may drop again unexpectedly. This is about the second risk. Unexpectedly, blood glucose level may drop again, like a hypoglycemia. Then it could cause irreversible damage to internal organs, means damage which is irreversible. Okay, so overall, this is the difference between A, B, C. So you need to identify from the audio which is the most risky according to his statement. Okay, what are the information comes under his statement? That is which one is given here and which one is most suitable, that you have to select. Okay, finally you can predict the topic and tone by using the question content. Clear? Dr. Hughes advises? 34th question. That risk of hypoglycemia can be minimized by. So minimize itself, we can do the third task, that we can predict, right? Minimize means like a treatment or the prevention. So this is also based on his opinion. The related content is risk of hypoglycemia can be minimized is an another clue. Look at the answer options. Scan the answer options. Having medical personnel present during physical exercise. When you perform exercise, you should have a person who is very specialist in that. This is by doing that, you can minimize the risk of hypoglycemia. Second thing is ensuring individual with diabetes carry fast acting sources of glucose. Fast acting sources. So by taking that, you can reduce the risk of hypoglycemia. And then last one is avoiding all forms of physical exertion. No physical exercise hereafter. No muscular activity. So C given. So three of them have different statements. So you have to select which is most appropriate from the audio and which is suitable for the question that you can log at last. Okay, finally you can predict it how we are selecting this. Then look at the question number 35. What is Dr. Hughes' perspective? So perspective means viewpoint expression. Okay, so here question asks you to find out Dr. Hughes' viewpoint on whether individual with the diabetes require constant medical oversight. So whether individual with the diabetes needs medical monitoring or not. So this is the question. So based on his perspective, what he is expressing, that you have to identify. So question terms we have underlined. Then we are moving to the scanning the answer options. Look at option A. They need regular supervision from healthcare professional at all time. So they indicates individuals with the diabetes. Okay, regular supervision. So that is about constant medical oversight from healthcare professionals at all times. Okay, we can see the option B differentiation. They can largely manage their condition independently with the right tools. By itself, you can understand clearly. They can by with the right tools. Right tools means like a GRBOs, insulin, and other management devices. So last one is they should depend primarily on continuous glucose monitors on for daily management. So they can completely depend on the CG monitors for daily management. So based on the audio, you can confirm with the right answer. Got it? So finally, you can use your perspection. First, you are identifying his viewpoint. Second one is you are differentiating answer options. Third one is you are predicting the situation or the content which is more suitable for the question. So and when you have to predict as well as your prediction would be more suitable with the answer audio too. Clear? So this is the final question in the extract one. Dr. Hughes believes, okay, his hope that advanced diabetes technology, so about technology such as insulin pump and CG monitors. Okay, so about CG monitor and insulin, what is his belief? Again, you are searching his perspective, Dr. Hughes' viewpoint, Hughes' opinion, suggestion, attitude. So these are the things about Dr. Hughes. Okay, so if you're focusing on the doctor's each and every expression, you can identify answer from the audio based on this extract. Okay, and remaining question parts you can consider as question keyword to locate your answers, where actually they are speaking, related what they are speaking. Clear? So first read thoroughly, quickly read through the questions. First task over, so you're underlining the question stems. Okay, so based on opinion, reason, advice that we are answering. Then look at the answer options. Scan the answer options. Like next 45 seconds will be occupied for all the answer options reading. So option A, that will these technologies, okay, technologies will become more prevalent as they become more accessible. So okay, when it is easily accessible, that time it will become more prevalent. Then second option, difference, should immediately replace traditional methods for all individuals. So this is different from A option, right? So immediately replace the traditional method for all individuals. This is technology and traditional methods they are saying. Then last option indicating are currently too expensive. Like the new technology was too expensive to widely implemented in the near future. Means in future it will be widely implemented, like a future anticipation they are saying in the future it will become a too expensive too. Like, okay, so based on his belief, okay, his belief means about the CG monitors and the insulin pumps, what is his perception for the future, or what is his belief for the next second. Okay, so you can predict your answer, who is speaking, what type of statement they are providing, and whether it is opinion, recommendation, what type of statement they are giving here. Everything you can predict, and after playing audio you can confirm your answers. Okay, so when you're answering options, don't put tick, you should trace the answer option. Clear about it? So if you follow this method, this is very easiest method. When you see this first step, it will be like a simple lookup, but when you are practicing and going for finding answer rationals, you can really understand why this is very important. Okay, so that's all about the 90 seconds utilization, and I have shown now how to apply the 90 seconds strategies on this examples. I hope this session is really helpful. We can see with the further videos in our future sessions. Thank you.